The nation's leader detailing a plan to address the housing of COVID-19 patients in quarantine and other measures connected to the emergency powers orders. Welcome to the Bahamas Tonight, the weekend edition. I'm Jiminita Swain. Thanks so much for joining us. Topping news. In a lengthy address, Prime Minister the Most Honorable Dr. Hubert Minnis outlined the plan to monitor COVID-19 patients, explaining measures to augment the availability of beds, and 2 hotels will now be used to respond to the pandemic. There will also be the relaxation of restrictions under the emergency orders starting tomorrow. Alto's Munnings joins us live in studio with more on the Prime Minister's national address. Good evening, Alto.
Good evening, Jiminita, and good evening, Bahamas. In his 42-minute national address, Prime Minister the Most Honorable Dr. Hubert Minnis announced there are now 898 confirmed cases of COVID-19 nationwide, 417 in New Providence, 389 in Grand Bahama, 45 in Bimini, including 6 in Cat Key, 28 in Abaco, 12 in the Berry Islands, 3 cases in Cat Island, 3 cases in Exuma, and 1 case in Eleuthera. Today's dashboard shows 777 active, 104 recoveries, and 35 hospitalized cases. 6,343 tests completed. There are 15 deaths and 2 non-COVID-19 related deaths. Now, the Prime Minister painted the grim picture of the Princess Margaret Hospital's bed capacity, pointing out that as the hospital approaches capacity with limited hospital beds to treat those with inpatient care, PHA has sought alternate accommodations. He referenced 33 individuals who are permanently staying at the Princess Margaret Hospital as boarders at a cost of $491 per day or $6 million per year. He said many of these patients have comorbidities that make them vulnerable to viral infections. This is why Princess Margaret Hospital officials will operate a new national COVID-19 response facility.
The plan is to utilize the east building of the hotel as a national response facility to meet the needs of non-COVID-19 low medical care patients during this pandemic. And this facility will accommodate both employees that are attending the patients on one floor and clinical and management operations on other floors. Security services will be provided by the Royal Bahamas Defense Force, supplemented by the Public Hospital Authority contracted security firm. This facility will be up and running very shortly.
Now, the new National Responsive Facility will be housed at Super Clubs Breezes and Cable Beach, and government has been asked to cover utility costs as the National Response Facility operates. Meanwhile, the South Beach Center will be used to address mild to moderate cases, and the Princess Margaret Hospital and Doctors Hospital West will address moderate to severe COVID-19 cases. And add to that, a new contact tracing center at the Melia Nassau Beach All-Inclusive Resort.
This center will strengthen the surveillance unit's ability to identify new cases and contacts and to intervene with the appropriate measures. Health officials anticipate an increase in the number of new cases over a short period of time. A decrease in new cases is anticipated once all new cases and contacts have been identified. It is important that members of the public cooperate fully and honestly if they are contacted by the surveillance unit. Your responsible behavior can help reduce the spread of COVID-19 in the Bahamas.